I am State Representative Jillian Gilchrest, and we are here today with the Endometriosis Working Group to announce our 2022 legislative recommendations. So pleased to be a part of this amazing group of individuals. I want to recognize that we are joined by Senator Julie Kushner, Representative Eleni Kavros-DeGraw, and Representative Kathy Kennedy. I want to also give recognition to Sarah Fox, who has joined us today. Sarah came to me now, I don't know if it was 3 or 4 years ago, to explain what endometriosis is, and that she thought it was an issue that I'd be interested in and might want to focus on. And you were right. And so thank you for being the impetus of bringing this amazing group of people together. I want to thank all the working group members, the presenters we've heard from, and those who have shared their experiences. The working group formed in September. We have been meeting since then, and we have heard a number of amazing presentations. I'm just going to run through some of the topics we learned about in these last few months. We learned about best practices in diagnosis and treatment, the latest research on endometriosis, symptoms and side effects, the impact of endometriosis in communities of color, the normalization of pain management alternatives and nutrition. Sorry, I've got people entering, I'm gonna let them in. Genetic links of endometriosis, barriers for the LGBTQ community, breastfeeding and endometriosis, screening tools in pediatric settings, insurance and Medicaid coverage, and education in middle and high school. So we covered quite a bit in our short time together. And so today we are here to announce our recommendations. First and foremost, our number one recommendation is that our work is not done. I think what all of us learned is that endometriosis impacting 1 in 10 individuals with a uterus, with an average wait time of diagnosis being 10 years, is something that needs to be committed to, that we need to continue to dedicate time to address in the years to come. And so this working group will continue to meet. I'm going to quickly share my screen just to show you all the amazing recommendations that I think are amazing that our group has come to. If I can get to them, give me 1 second. So our policy recommendations are training for healthcare provider, school nurse training, menstrual equity, access to medical care, fertility preservation, education for students, data collection, and research. And to dive in a little deeper to just a few of these, we know that women's health has been historically under-researched in this country. And currently the only way to diagnose endometriosis is with surgery, and there is no cure. And so we are fortunate to have researchers right here in the state of Connecticut who want to pursue ways to test for endometriosis and develop treatments. And so one of the recommendations is to develop a partnership with the Department of Public Health to be able to initiate clinical data and tissue collection. Additionally, a huge takeaway was just the lack of understanding, knowledge, and awareness amongst medical providers themselves of endometriosis. And so one of our recommendations is training for healthcare providers. And then finally, a big conversation was how individuals who experience endometriosis are made to feel crazy for years, that what they're experiencing is all in their head, that pain is normal when it's not. And so some of our recommendations are to require school nurses to receive an Endo What school nurse training, which they would receive credits for. And then additionally, working with the State Department of Education to ensure that when students are learning about human development and growth, that they would learn also about endometriosis. So with that, I am so pleased to have a number of tremendous working group members and speakers with us today. And so I would like to turn it over now to Bria Gadsden. She's the founder and executive director of Love Your Menses.
Thank you so much, Rep. Gilchrest. It's a pleasure to be with you all today. Once again, my name is Bria Gadsden, and I am the co-founder and executive director of Love Your Menses. I am also a Connecticut resident living in Hartford County. At Love Your Menses, we promote menstrual equity by ensuring girls and gender expansive youth, as well as adults, have access to menstrual health education, the resources they need, so that way they can flow through life unapologetically. Love Your Menses fully supports the endometriosis working group recommendations. We must ensure adolescents and adults across the lifespan have access to safe menstrual products and the menstrual health education that they need to fully understand their bodies and how to advocate for their reproductive health when concerns arise, such as endometriosis. In addition, we must ensure healthcare providers are culturally competent and equipped to effectively address the reproductive health needs of all people who menstruate. We can do this through training on endometriosis. That includes information on systemic racism, explicit and implicit bias, microaggressions, racial disparities, and experiences of transgender and gender diverse people. We look forward to continuing to address reproductive health inequities within the state of Connecticut and leading the charge and supporting those who experience endometriosis and other reproductive health conditions. Thank you to Rep. Gilchrest and the entire endometriosis working group for uplifting the voices of those who experience endometriosis. I am confident that these recommendations will lead to better education, diagnosis, treatment, and support.
Thank you so much, Bria, for being here, for being a part of this work, and for the work you do every day. Next, I want to invite Dianna Falzone. She's the Endofound ambassador and executive producer of EndoTv.
Well, thank you so much for having me here today. And thank you for all the work that you have done, Rep. Gilchrest. It's just incredible and an honor to be speaking. As you said, I'm Dianna Falzone. I'm ambassador for Endofound, which was co-founded by Padma Lakshmi and Dr. Tamar Sechkin over a decade ago. When I was 15 years old, I was away at summer camp and I experienced heavy bleeding, nausea, vomiting, and excruciating pain. I had no idea what was wrong with me. My mom rushed and picked me up. We went to the gynecologist's office and the gynecologist said, here's some birth control, and assumed it was an ovarian cyst that burst. Never once was endometriosis mentioned. Years and years and years went by and I continued to suffer from debilitating pain. And I was in and out of doctors' offices. And again, no one mentioned endometriosis. I came to believe that I was just an unlucky person with my period, that some people had it worse than others, but never once did I think I had an actual disease. I was first diagnosed with endometriosis in 2016 at nearly 33 years old, after experiencing acute pain that led me to the ER. I also experienced heavy bleeding outside of my menstrual cycle, a low-grade fever, and nausea. A hospital doctor told me it could be the flu or hormonal imbalance, and that if I couldn't handle the pain, I could, quote unquote, bleed it out. Nevertheless, I was no longer a teenager. I was a grown woman with a voice. I knew something was wrong with me, and I persisted in finding an answer. Fortunately, I found a reproductive specialist who actually listened to me and had a suspicion that I had endometriosis. Endo is one of the leading causes of female infertility, a known precursor to ovarian cancer, and a primary reason individuals born with a uterus ages 25 to 34 have hysterectomies. As we mentioned earlier, it takes an average of 7 to 10 years to be diagnosed, and it is often misdiagnosed as things like IBS, appendicitis, or various other disorders. It takes an individual born with a uterus, sometimes their kidneys, their ovaries, and so much more. It costs nearly $78 billion a year in healthcare costs and lost wages. And guess what? As Rep. Gilchrest mentioned, there is no cure. There are no easy treatments. The specialist recommended that I undergo excision surgery, which is considered the gold standard of treatment for the illness. At the time of my endodiagnosis, I was informed that I was also infertile. Learning I was infertile was absolutely crushing, as I wanted to become a mother. I underwent several rounds of IVF in my attempt to become pregnant, and I was fortunate. I did. I have my 3-year-old son, and I'm thankful every day because I know that is not the story of everyone else. I felt incredibly alone. Endo wasn't talked about that much. I found my support groups online, And I learned about Endofound and how it helps the 1 in 10 with this insidious disease. As a result, I volunteered for many years using my platform to educate and raise awareness to support Endofound's advocacy efforts. These efforts led to New York passing historic legislation and requiring the health and education commissioners to create materials on menstrual disorders, including endometriosis, and make them available to schools and medical practices across the state. In addition, this legislation has led to grassroots movements to other states to enact similar legislation. Endometriosis has changed the course of my life. There are moments that I think back to if I was 15 years old and that doctor said I had endometriosis then, would I have been saved from multiple excision surgeries? Would I have some of the organs that are now removed because of the disease? Would I have had to go through IVF? Would I have not had to suffer so long? And I don't say this about me. I say this because education can help change the course of someone else's life. We are here today to make sure that the younger generations are equipped with knowledge, because that is power, and the access to these educational materials that can change the course of their life. We can do this now, and we can do this together. Thank you all.
Thank you so much, Dianna, for being here today and for all of your advocacy and using your experience and your voice to impact the lives of others. Thank you. Next, we're going to hear from Lauren Cornegay. She's the founder and executive director of Endo Black Incorporated. My apologies. Lauren.
Thank you so much. As she stated, my name is Lauren Cornegay, the founder and executive director of Endo Black Incorporated. I first want to say thank you so much to State Representative Gilchrest for having me here today. She allowed me to come speak on her platform prior to encourage people and to share information about Endo Black. So I believe that the work that they're doing is very imperative in the community. As I stated before, as the founder of Endo Black Incorporated, we are a nonprofit that focuses on advocacy work and education, advocating for African-American women and women of color affected by endometriosis. I started the organization in 2019. However, I was diagnosed with endometriosis on March the 18th, 2011. And with that journey, I began to learn so many different things about endometriosis, as well as so many things I was very confused and clueless about. That is why I am standing behind the Working Endometriosis Group and the recommendations that they are putting forward. As Diane said, education is so powerful. It is so imperative to the patients, as well as to medical professionals, as well as to young people within the community. The recommendations that I've brought forward will show us and also encourage those to really get into what it is that really affects people with endometriosis. I believe that this will allow us to really come together in the community. I also believe that working together with medical professionals as patients will allow us to get a lot more answers than what we have in the past. Again, I'm so thankful to Representative Gilchrest, as well as the Endometriosis Working Group. I believe that these recommendations will make a positive impact on the lives of those in the endometriosis community. Again, I'm so grateful just having the opportunity to be here. I advise everybody to make sure they continue to fight, to continue to raise their voices, and continue to make effort in the community to make a difference. For those who may not be aware of endometriosis, I ask that you do your research, because someone in your life may be affected by it and you may not even know. To end this off, I want to share that for Endo Black, our philosophy is to educate, encourage, and engage. And I hope that we can all continue to do that within the community. Thank you.
Thank you so much, Lauren, for being here, for your support and the work you do. Next, we will hear from Heather Giadone. She is the Surgical Program Director at the Center for Endometriosis Care. Heather?
Hi, everybody. It's Heather Giadone, she, her, hers. I am a board-certified professional advocate and the Program Director of the Center for Endometriosis Care. I'm also a Hudson Valley native and an endo patient myself. And I, of course, absolutely have to thank Representative Gilchrest right away. It has been an honor and a privilege to be a part of your working group. I applaud the efforts. I applaud the work that you are doing. And I really appreciate the collaboration because this is not a partisan issue. The only way that we are going to make strides and make changes in endometriosis is by engaging all stakeholders and collaborators to make a difference. Like my colleagues have presented today, I too struggled with endometriosis. My symptoms actually started very early on, like many people's do, in adolescence. And I was told that it was stomach problems. I was, anxiety ridden. I was nervous. Then later, after the pain persisted and increased with menstruation, then it became, that's just how it is. So I really, like everybody else, probably struggled silently until I finally couldn't take it anymore. And I found, luckily enough, someone who took me seriously, took my pain seriously, and diagnosed me. And this is back in the 80s. So it's, the struggle didn't end there, though. It really was another 10 to 15 years of repetitive failed surgeries, rounds of IVF to deal with infertility. It was countless medications that really just were devastating. The side effects were devastating. And it wasn't until I found my endo specialist out of state, 3 hours away by plane, that I was able to get any help. So it's very sad that now, almost 30 years later, people are still struggling with the same exact problem. So part of the working group's efforts, and ambitious as they are because they need to be, is really to ensure that we are improving the state of education, making sure that everyone has access to gold standard care, not just the privileged, not just the few. We are looking to really institute early awareness so that people understand where, when, how to seek out care and diagnosis for endometriosis. We really need to improve the research, ensure that it's really directed towards translational benefits so that we're looking at tertiary prevention strategies for people struggling now. Really unlocking the mysteries. We still don't even know what actually causes endometriosis. And this disease is eons old. So all of these things and all of the efforts that the working group is putting forth is something that I absolutely applaud, stand behind, and support. And I will continue to be here. So thank you for letting me participate and, of course, be here today on my way to the Endo Summit. Thank you.
Thank you, Heather, for being here, for being an invaluable resource to me and to this group. And good luck at the Endometriosis Summit. That's very exciting. Finally, today, we're going to hear from two partners in the state who've been a part of our working group, Dr. Elise Courtois from the Jackson Laboratory and Dr. Danielle Luciano from UConn Health. Elise?
Thank you, Representative Gilchrest, for having us today, for your actions to raise awareness about endometriosis through this work group, and for your efforts in seeking to advance diagnostic, treatment, cures for those suffering from endometriosis in Connecticut and beyond. I am very happy here today to talk about the positive impact that the representative's proposal of a human tissue and data repository for endometriosis could have for the people of Connecticut. As you heard today, endometriosis is a widespread disease that affects 1 out of 10 female-born individuals. It is 6.5 million in the US and 200 million worldwide. And yet, despite this huge prevalence and the associated burden, endometriosis is a disease that remains largely not understood. So endometriosis is a very complex and highly heterogeneous disease that leads often to being misdiagnosed or missed altogether. And when it is diagnosed, it happens in average 7 years after the onset of the first symptoms. So because of this delay, we have a poor understanding of the conditions that fosters its initiation, progression, and recurrence. This is a lack of fundamental understanding of the endometriosis biology. And it's the reason why we don't have proper treatment options. So we need more investigation so that we can have proper molecular and genetic markers to detect this very complex disease early enough to treat it. And we can obtain proper and accurate understanding of endometriosis by creating collection of data, clinical data and biospecimen for Connecticut. And we can do that through combining surgical and clinical with biological sample information. We also need to have sufficient power for extensive and representative data sets that covers all patients, all backgrounds, all communities that are affected by this disease. This will also allow us to disseminate information and raise awareness towards improving our understanding of endometriosis in an unbiased way. So I really applaud Representative Gilchrest's proposal to initiate a clinical data and biorepository program in Connecticut. It will provide us researchers and clinicians with the tools we need to affect real progress in the fight against endometriosis.
Thank you, Elise, and thank you, Representative Gilchrest, for inviting us to speak today about endometriosis. So we've heard about prevalence, we've heard about symptoms, we've heard about lack of understanding. I want to tell you about my patients who are just like Dianna and Lauren and Heather. These are patients that I see every day with endometriosis in my referral center. They've suffered from pain and infertility. Their symptoms have been dismissed by their previous doctors, and they're frustrated and they're miserable. And then I offer them treatment options that are far from perfect. They're invasive, like surgery, or they put them in a pseudomenopausal state, or they have terrible side effects, or they interfere with them getting pregnant. And then the worst part is that all of these treatments aren't even a cure. I can't even promise them that their symptoms and their disease isn't going to come back. I work at UConn Health, where I teach medical students, residents, and fellows about endometriosis every day. I give lectures to community healthcare providers to raise awareness. I try to teach about endometriosis so we can promote early detection. And then I started doing research at Jackson Labs. And when I started doing this and I told my endometriosis patients about this, they were so eager to be involved. They wanted to do anything that might help their sisters, their daughters, their granddaughters someday, just so that they don't have to suffer like they're suffering. With this endometriosis working group, Representative Gilchrest has set the stage for improving the lives of all of the endometriosis patients in Connecticut. And I'm so proud to be a part of this. But by creating this biorepository, this collection of clinical data and biospecimens for the state, we can promote research, we can advance diagnostics and treatments, and we can continue to teach and raise awareness about this really complex disease. UConn and Jax, we're already invested. We're ready to do this and we're ready to move forward. And I'm just super excited to be a part of this. And I'm so proud to be a part of this working group. Thank you very much.
Thank you so much. And thank you again to all of our speakers and the entire working group. When we launched this working group, we were fortunate to get media coverage. And within the first month, more than 30 women reached out immediately. And so to hear what the doctor just said about her patients, there is a need and an urging and a desire to form community and to get help, because the help isn't there at the level it needs to be. And so I appreciate everyone giving me such respect today, but truly thank you for taking part in this working group and being committed to moving this forward, because once you learn about it, you can't unlearn it. It's one of those issues. And we're all dedicated to it, and we're going to see to it that we make change. And this is change for all women. We have too much inequality in our state and in our country. And so as we move this work forward, we need to ensure that we're bringing everyone who's impacted by endometriosis along with us. With that, I will put us all onto the fun gallery view and see if there are any questions from the press. All right, seeing none, please know that you can read our press release that will be released and our recommendations. Thank you all again for being here, and I'll see you at our next working group meeting.
Thank you.
Thank you.